Hi guys, it's Susie. I'm an occupational therapist and certified driver rehabilitation specialist with Adaptive Mobility Services. I'm coming to you from my car today. This is my treatment environment when I see clients. I work with individuals who are looking to return to driving after an injury or illness, or individuals who were considering their role with driving versus becoming a passenger as they face a progressive condition. But I'm actually coming today from the standpoint of a private practice owner. I have a very good friend who is planning to expand things within her practice. We recently have gone through a couple shifts here at Adaptive Mobility Services, with the lovely Gabriella transitioning to doing administrative support, and then Dan coming in for driving rehab support. So it just seemed like good timing, a good topic to talk about things that we can do as private practice owners to prepare for new hires. So first and foremost, my best recommendation is trying to find the right fit for that, the role, whatever you're hiring. And, initially, I think I've made this mistake in the past, not with my current team, obviously not with Gabby, but when I've worked for different rehab companies, we always try to hire the most qualified individual, thinking about that individual's personal skill set with regards to occupational therapy or driving rehab. And while I think there's a lot of value in thinking about that skill set, over the years, what I have learned is that it's more important for me to hire the right person with the right personality, with the right kind of philosophy and ethical alignment. And so I encourage those of you who are looking to expand, hire the right people, in that the right people are a right fit for you, that you mesh well with them, that you communicate well together, that you align on your ethical standards and values. And those other pieces, the technical skill sets, tend to come as long as you can have a good working relationship and you almost see eye to eye in the other areas. So I encourage people to kind of thinking about that as they expand, right? Okay. The next couple things I have just been thinking about and jotted a few notes down, so you want to hire, how do you move from a solo practitioner in private practice to becoming somebody who has a couple different employees, and everyone's going to have a decision about different standards of what they've met in order to, if it's whether or not time to move on and hire people. For me, I wanted to think about how long was my wait list? What was my current bank account looking like? Did I have expenses to cover, 3 months if something were to happen? And what did the market look like? Then I had that conversation with my small business accountant that really helped me to solidify whether or not I was ready to grow as a practitioner and with my practice. So after I find the right person, the right personality match, other things you want to make sure you have lined up and in order are things like, do you have a job description? You should have a job description for yourself, but you also want to make sure you have a job description for the role that you're filling. Do you have program policies or program guidelines written that talk about who can use the vehicle, how the vehicle can be used? What is your fee schedule? That should be documented and written down. What is your standard of practice when it comes to things like intake, flow, paperwork? How soon do you expect that documentation to be completed after somebody's seen? What are the follow-up requirements? And a lot of these things are kind of like your playbook that you might have in your mind, but have you taken the time to write that stuff down so that it's documented somewhere, that one can become a training manual for your employee, but also becomes a standard of practice should things deviate from there and you need to work on improving performance in any area. I think other areas that are important to make sure you have covered is, definitely talk to your small business accountant. How will you set up the payroll? What documentation is needed for those different pieces to work? And for me, meeting with my small business accountant was also very helpful for figuring out things like workers' compensation. In my state, it was difficult for me to get workers' compensation insurance through my current insurance provider, but I was able to tap into my own state workers' compensation fund. So thinking about those pieces as well. So what is the risk to myself as somebody hiring employees? Do I have that risk covered? What documentation do I need in line to help them with payroll? And then thinking about what documentation pieces do I want to have in line to support an employee? So for me, I want to have a copy of their current CV and resume. I need to have current references that I can reach out to. I currently operate in Pennsylvania and New Jersey, so my employees need to have occupational therapy licenses in New Jersey and Pennsylvania. Had a small conversation with my small business accountant. We both felt confident because of the standards around what it takes to have and maintain an OT license in the state of Pennsylvania, the abuse clearance that you have to go through, the fingerprinting, that would serve enough in our comfort level for a background check. But do you want to run an additional background check? Or would you like to have them sign a personal attestation of moral character? Think about those different pieces. Clearly, because we're talking about driving, I also want to have somebody who is a licensed driver, right? So I need to have a copy of their driver's license. I want to have things like an emergency contact should they not feel well or things not go well. And then, other main pieces for paperwork, let me think. So OT license, driver's license, attestation of good moral character, their CV, and then I have a contract with them, and their contract does read as their job description, as well as whatever we have negotiated for their pay rate. And when we think about pay rate, there's lots of different ways you can do that. Typically, most people tend to earn between 40 to 60% of whatever they're earning. And so you can use that, will you pay them hourly? Will you pay them based off of what their income is and what they're providing? Will you pay them for documentation time? These are all things you need to think about and negotiate in advance so that it's very clear and that you both know where you're coming from. I think it's a very exciting thing to bring on new staff members and to hire new people. There are a lot of different elements to kind of think about and consider, but these are easy things that you can just organize and put in order. One of the things I've done for myself, in addition to having my program guidelines written for intake procedure, documentation procedure, vehicle procedure, inclement weather closing procedure, fee schedule, is how do I do a new hire? What does the new hire paperwork and steps look like? So that the next time I do this, I have everything in order. I can just pull it out and go from there. I hope this is helpful. I hope this gives you a couple things to think about. I think more occupational therapy practitioners need to consider private practice. Having a private practice, it can be tough when it's yourself, and it can be a little daunting to take that next step to bring on new hires. But it's something that you should really think about and consider if it's right for you as you're growing your practice. And of course, the more people in the field, especially of driver rehab, the more we can serve. So I'd love to hear from you. Are you a private practice owner? Do you have ideas, tips, thoughts around additional things you would think about or consider when hiring somebody new? What do you do to ensure that they've done the proper training? Do you gather certificates of completion? Do you look for specific credentials? How are you making sure that that person in that role fits all of your needs? Okay, love to hear from you, and I hope this is helpful. You guys have a great day.